My video is over Chapter 16, Ophthalmology, which is the diagnosis and treatments of the disease and conditions of the eyes and vision. I find this chapter very interesting due to the fact that my mother was diagnosed with cataract in OU. This is where the lens becomes cloudy with protein deposits, resulting in the whole vision field becoming blurry. The only way to fix OU is surgical replacement of the lens by removal of the occluded lenses and implanting a new artificial lens in the shell of the natural lens through the pupil and behind the iris, in the procedure called the intraocular lens implant, which is also called the IOL. First, an incision is made in the cornea, a clear dome-shaped tissue covering the front of the eye. An anesthetic gel is inserted under the cornea to relax the iris, the muscular colored part of the eye, in which controls the amount of light that enters the eye by changing the size of the pupil. This enlarges the pupil, which is the opening in the center of the iris that can change its size as the amount of light changes. The more light, the smaller the hole. Just behind the iris and the pupil is the lens, a crystalline structure that focuses light into the retina. The retina is a sensory tissue that lines the back of the eye and contains millions of photoreceptors, rods and cones, that convert light rays into electrical impulses, which are relayed to the brain by the optic nerve. This inserted gel during the operation also helps maintain the shape of the eye, keeps the vitreous from escaping. The vitreous is a thick, transparent liquid that fills the center of the eye. It is mostly water and gives the eye its form and shape, also called the vitreous humor. During the surgery, a circle in front of the top layer of the lens is removed and the two inner layers broken up and removed. The artificial lens is inserted, and little spring-like extensions slowly unwind and hold the plastic lens in place. Bandages and a metal patch controls the bleeding and protect the eye. 24 hours later, when the bandage is removed, the patient can see more clearly, but the healing and vision improvement continues for weeks. My mother has also had to wear contacts or glasses, including bifocals, for stigmatism and nearsightedness. Since the first replacement in August, she is now able to see objects across the room without glasses for the first time. My mother returns for checkups to make sure the implanted lens has not been moved. If so, the ophthalmologist moves the lens back in place so it heals up correctly. Antibiotic drops and anti-inflammatory drops keep the healing process. The success rate for this procedure is 97%. There are several other common eye diseases we need to be aware of besides cataract, including diabetic retinopathy, glaucoma, and amblyopia, which are, if not treated correctly, can cause blindness. There are still some rare diseases in which doctors still don't know how to repair, such as retinitis pigmentosa. Thank you and have a good day.